My first question to you, doctor, that what type of emergencies you have handled as BDS?
Sir, in my clinical practice, syncope is most common emergency. So it has a psychological as well as non-psychological reason because of fear the patients have regarding injection or treatment medicines. They usually have a fainting. That is loss of consciousness, temporary loss of consciousness. So syncope is most common, and the second is like bleeding. In case of abscesses, cellulitis, bleeding is very much like common to people. Then other are regarding to blocks I have faced and managed.
Okay. Okay. Now you tell me about anodontia.
Sir, anodontia is the congenital teeth deformity in which some of the teeth are absent. It is congenital. It present at the birth anomaly. Some of the teeth are absent, or maybe even all teeth are absent.
Okay. Tell me about ECC. What does it mean?
Sir, ECC is echocardio. What's ECC?
Yes. Early childhood cavities
ECC.
or caries. Okay. Now explain.
Sorry. Sir, early childhood caries. These are present like in neonates or in adolescent age. These are due to the wrong feeding habits, poor nutrition, then improper cleaning habits. In the like babies used to have milk at night sometimes, so they don't drink water after that, so the uh, plaque layer remains on the tooth surface, and that can lead to caries formation. These are called as early childhood caries, sir.
Okay. Tell in detail periodontitis.
Sir, periodontitis is actually the severe form of gingivitis. It is a gum disease. When gingivitis is not treated, it leads to periodontitis. Uh, in periodontitis, the plaque is not removed from the tooth surface. So, after because of improper cleaning habits, that plaque gets hardened and converted into calculus. And calculus is a very hard stone-like structure that gets embedded between the tooth surface and the gingiva surface, and deep pockets are formed. That is called a periodontitis, sir.
What motivates you to be a doctor in dentistry? Like why you opted BDS?
Sir, since my childhood, I am very fond of doing like decorative works, interested in craft work, and in by the standard 10th, I get more interest in biology and science compared to math. So I choose medical side, and then when I searched, then I found that all my habits meet in dentistry. Like compared to MBBS, in dentistry we had a combination of like a study plus artistic work, engineering works, all those combinations. So I thought it will be interesting for me, and I am very happy to be a dentist.
What qualities, according to you, a dentist must have?
According to me, a dentist must have the quality like empathy, that he can understand, correlates with the patient's feeling. Then another like teamwork, stress management, time management. Then he or she must have communication skill, good language on command, and convincing skill also.
That's great. Now tell me about dentine dysplasia.
Dentinal dysplasia. Sir, it is like a dentinogenesis imperfecta. That means it is also a congenital congenital tooth malformation. In this, the dentine inner layer of tooth surface, that is dentine, it is not formed well, so teeth becomes weak, pale in color, little bit yellowish in color, and it is not having any treatment. So only prevention can be done.
Okay. Once I visited one of my doctor, Adarsh hospital he's having. He's a dentist, Dr. Anil. Very nice doctor. So why doctors like dentists are always having a smiling face? Because he always smiles and meet gently. So why is it so?
So, sir, I think we are the one who creates smile. So it's better we give a smile. That's why we create smile.
You create a smile. We accept. Even I really regard
Yes,
that
sir.
doctor. Dr. Anil, he's a very good doctor. Now you tell me the benefits of dental X-rays.
Benefits of dental X-rays. Sir, exposure is less.
Okay.
Time is like less time consuming.
Okay.
Even setup is also compared to ultrasound, compared to is like less setup is there. And now so much advances have come, like portable X-rays, in which uh, only a hand machine, like it's like machine which we can hold in hand, and within a fraction of seconds we can see those videos, see those X-rays on the screen. So dental X-rays are beneficial, advantages, and
Doctor,
that's why.
many of my students are in ADC, Army Dental
Sir.
Corps.
Okay, yes, sir.
So there is one common question, like there is one common question which is being asked there is that how you are different from others? Like why should we select you only? Then what would be your answer in this? What type of achievements you have in your life? Whatever you want to say, you can answer. Why should we select you?
Um, Sir, according to me, I have done the clinical practice, and after that, I have done a job in non-clinical sector also. I was working as a medical reviewer in Medline's company at Bangalore. So I have both the experiences, and also it's been like 6 to 7 years since I have been passed out. So I have more experience also, and throughout these years I have learned so many skills. I think I'm very flexible to adapt any new situations. I can learn very fast compared to them, as I'm experienced and mature. So I think I can be more compared to others, sir.
Okay. My next question to you is, what type of local anesthesia and administration techniques you use for routine basis?
Okay, sir. Basic types of local anesthetic drugs we used are lidocaine, prilocaine, then bupivacaine, mupivacaine. These drugs we used as a local anesthetic. Most common is lidocaine, and there are different techniques for mandibular anesthesia. We used inferior orbital block and inferior nerve block, and long buccal, and as well as lingual block for mandibular teeth. And for maxillary anesthesia, there are different blocks like PSA, posterior superior alveolar nerve block, infraorbital nerve block, and then also G block, that is greater palatine nerve block. These are blocks. Sorry, sir, you are not audible. Hello,
Got your point? Like during your job profile, you have
sir.
done 2 years job, right? So in your job profile,
3 years of clinical practice.
3 years of clinical practice. So during your job profile, what type of patients you have seen? Like common, what type of cases comes to you?
Sir, in pedo patients, mostly are nursing bottle caries. That is, the babies having caries in the upper anterior teeth because of improper cleaning and feeding at night, bottle feeding at night. This that leads to nursing bottle caries. So, in pedo, this is the most common. Then in adult, mostly the cases of root canal, and in older patient, the cases of gingival diseases like gingivitis, periodontitis, weakness of bone, weakened bone strength, gingival tissues, dentures. Such patients I have seen.
Okay, when should one consider dental implants?
So for dental implant is actually the advanced procedure to replace a teeth. It is good compared to bridges and crown, but for dental implant, the bone strength should be uh, bone strength should be more. And in adults we can give the dental implants when we don't want to use the supporting teeth. Then we can go for implant. That is the best solution
Okay.
when we don't want to include the supporting teeth.
What is MIH in dentistry?
MIH.
Molar incisor hypomineralization.
Okay, sir.
Tell about.
Uh, it is actually, sir, it is developmental deformity in the tooth that mineralization is improper. That is called as hypomineralization.
Okay.
That's it.
Okay. Uh, Now you tell me about oral cancer.
Oral cancer. Okay. So tobacco is the main reason for oral cancer. Smoking is also a leading cause. And in that leukopplakia is one such pre-malignant condition in which white plaque lesions appear on the buccal mucosa, tongue, and even the cheek mucosa. These are actually painless lesions, but we should seek treatment for it because it is a signal or it is a pre-malignant condition. Later on, patient gets difficult for opening the mouth, then difficulty in opening the mouth, and also pain. It causes pain when that lesion comes in contact with the sore and uh, more sore foods, then it can causes pain. Initially these are painless, but later on the condition worsens and it can convert it into malignancies. So tobacco, avoid tobacco smoking, and have a proper hygiene that can be done.
Okay. Doctor, tell about burning mouth syndrome.
Burning mouth syndrome. um Sir, currently I'm not uh,
Okay. Tell
getting.
about thrush. It's a fungal
Sir,
infection.
thrush. Yes,
Management also, I
sir. Yes, sir. Sir, it is also called as oral candidiasis or oral thrush. It is a yeast infection. It is an opportunistic infection caused by Candida albicans. It is a fungus. In this, a white pseudomembranous patchy plaque which is very resistant. It forms on the tongue surface. It is very resistant, cannot be removed, and the patient in the initial stages have angular cheilitis, aphthous ulcer formation, and it can lead to dermatitis, that is Candida albicans dermatitis. It is called as diaper rash, and it also leads to esophageal varices. That means the candida infection which is present in the mouth goes into esophagus, and it is called as candidial esophageal candidiasis. It is opportunistic infection. It spreads with contact, and
management.
some treatment for like drugs we can give in oral thrush is fluconazole, then sulfur creams, then ketoconazole and azoles.
Okay. Have you ever had helped any patient who was uncomfortable with a dental procedure?
Sir, can you please repeat the question?
Have you ever helped any patient who feel uncomfortable with any dental procedure?
Yes, sir. Many a times, like I have helped mostly pedo patients and the ladies patient because they have fear.
Right.
In pedo patient, the best thing is that they are very reactive. If they are having fear, they cry, they say loudly. So it is good thing about pedo patients. I explain if pedo patients are frightened, what I did is I show them the treatment on my laptop screen, that what treatment they are going undergoing, and later on I promise them that I will give them the some gifts like pencils and all that, so that they can convince for the treatment. And in the ladies patient also, I show them the treatment injection procedure also in the laptop animated video, then they get convinced.
Okay. Tell about gum recession.
Gum recession. Sir, in the initial phase, what happens? The thin plaque layer is formed on the screen because of improper cleaning habits. The plaque is a thin layer which contains microorganisms. It forms on the surface of teeth. When it is not removed, proper hygiene is not maintained, or extra sugary food if you have taken, then in that cases that becomes resistant and hard to remove. Then after few months and days, it converted into calculus, and that gets embedded into the gingiva and tooth surface. And after it takes months and years, and then what happens, gingiva starts receding, that is gingiva decreases in height, and the length of crown is increased, and gingiva gets resided in height, and that can lead to gum diseases. That is gingival recession.
Okay, doctor. Now tell me about your college life. What you learned and what type of whatever you want to say.
Okay.
Heartful.
Uh, Yes. So I choose BDS because I love the artistic work, and there is a combination of both, like education as well as I am able to get the chance to do such things. So in the first year, we had that block wax block, and from that we have to carve the tooth, and I love doing that carving, that giving the tooth shape, cusps, grooves. And then also in the third year we have the tooth restoration, like amalgam tooth restoration and composite. So after that condensation, the last stage is carving the tooth, giving the shape of cusp, natural tooth shape, appearance. So I like doing those things. In academic, I was a good student. Study, I always interested in doing study, but there I get the chance to pro, upskill my artistic work. So I enjoyed my dentistry, all my dental years.
Okay, what was your favorite subject
Sir, my
and
favorite
why?
subject was, oh yes, sir. Oral and maxillofacial surgery. Oh yes, my favorite subject. In that subject, extraction is the main treatment, and other or other surgeries in the head and neck sections. I love to give the blocks and extraction of tooth, because after extraction, that feeling is, I love that feeling that yes, I have done something, and patient is very satisfied, happy that without any pain I have removed their tooth, and the patient is now free from this pain. And extraction takes only like within half an hour, 15 half an hour, the patient is free from pain, unlike the root canal treatment, which is 3 4 sitting treatment. So I like OS department.
Okay, if extraction is your favorite, then how long would it take to complete an extraction?
Sir, it depends, like 1 hour, we can say 15 minutes to 1 hour.
Okay. In
I'm
your
giving anesthesia.
interns, okay. In your interns, what type of severity you have assisted or any special work you did? Tell about your interns.
uh, so my internship, I did impaction, molar impaction. It is a surgery, surgical removal of third molar, wisdom tooth. That I have assisted the seniors or the PG students. They did the surgery, and I have assisted it.
Okay. Tell about dry mouth.
Dry mouth. It is also called as xerostomia. So vitamin D deficiency also can leads to xerostomia or dry mouth. Uh, in this, the salivary glands secrete less amount of secretions, so it leads to dry mouth. And in this, patient is having difficulty in eating the foods and sour foods.
How are you feeling with us, doctor?
अच्छा लगा sir. Interview was really good. My experience is really good. The way you started, I feel comfortable, sir. Thank you.
कॉन्फिडेंस मुझे भी लग रहा है धीरे धीरे इट विल डेवलप